Stano for cyclists. Stanozolol, also known as Strol, is a substance from the anabolic segment. Many elite cyclists have already used this anabolic especially, and later men and women who sought more resistance. Muscle mass and fatigue tolerance also adhered. The cult of the highest place of the podium is part of the culture of many cyclists, and therefore the indiscriminate use of the substance in competitions and training, and often do not consider the consequences of their decisions in consuming certain substances that can bring great harm in the short, medium and long term. As always, our function here on the Mania de Bike channel is to promote safe information and reliable sources for our followers. We also highlight that we do not induce consumption of any type of anabolic or prohibited substances. And knowing that, I'm sure that now you will subscribe to the channel and like our video. It is worth remembering that to obtain better global results, it is advised to always follow a correct and balanced diet, make the necessary supplementation and have a coach. But come on, after all, what is stanozolol? Commercially, stanozolol is the name of the substance and Winstrol is the name of the product available for sale. Among cyclists, it is widely used by those who desire more muscle volume, resistance and fatigue tolerance in the legs. It also helps in a faster recovery each workout or competition, and with that you can train more and more and recover faster, getting more and more resistance and strength in the pedals. At first, scientists were looking for some medication that could fight certain diseases such as anemia and muscle weakness. It has been used as a drug mainly in the elderly and people immobilized for a long time. Also fight angioedema, which is a swelling in the tissue just below the skin caused by both hereditary diseases and hormonal diseases. Also fight bone mass loss, lack of appetite, physical weakness with muscle mass loss. For this reason in particular, it has become used by men and even women who seek muscle gains more quickly. The hormones derived from testosterone have beneficial effects not only for the recovery of diseases as we said, but also for those seeking to obtain better muscle definition, have a stronger sprint, gain resistance in climbs and greatly increase anaerobic limiting. Stanozolol, as an anabolic hormone that has a quick effect, can be used in short cycles, in different forms of administration. Among the advantages of stanozolol stand out. It is anabolic, meaning that it increases muscle development and calcium storage in the bones, without necessarily increasing the fat deposit. Higher muscle definition, no accumulation of liquids, promotes a younger appearance by reducing the liquid and fat of the subcutaneous tissue just below the skin, and increasing the production of collagen fibers that give the skin a more uniform and less wrinkly appearance. Increase of red blood cells considerably, and with that a super increase in resistance and strength in the pedals. Who can and who cannot use stanozolol? People who do not have cardiovascular diseases, hypertension, liver or hormone diseases can use stanozolol. Always recommend a shakape before the start of use. It is not recommended for pregnant women and infants. People very young, because this substance promotes the early closure of bone epiphysis, inhibiting growth in height. What can the excess of stanozolol cause? Even considered less harmful than other drugs of the same line, excess can bring serious damage. Stanozolol mainly causes overloads and even serious liver injuries, as it is in this organ that it is first metabolized. As it is an anabolic steroid hormone and is derived from testosterone, some unwanted effects can be observed, such as increased appetite. Its use should be accompanied by a balanced diet so that there is no gain of weight from eating too much. Overload of the liver, hepatotoxicity, and even irreversible injuries when used in high dosages and without cyclic intervals. Nausea and vomiting, increased hair loss by the body, articular injuries, promoting liquids for joints, irritability and insomnia, masculinization of female features, alopecia or loss of hair from the head, hypertension, alteration of sexual desire, lower libido, acne, gynecomastia, that is, increased tissue in the mammary region both in men and in women, increased prostate, increased heart muscle mass, heart hypertrophy, increased low-density cholesterol that deposits in the arteries causing atherosclerosis, cancer, if used in the long run. But how to take stanozolol? One of the advantages of this anabolic steroid is the possibility of using two different administration methods, oral and intramuscular. In fact, this is one of the few anabolic steroids that can be administered through the oral route. This way, you can adjust the dosage at low levels, reducing the side effects without reducing the desired beneficial effects. By oral route, for aesthetic purposes, or just for training in the preparation phase or base period, the minimum dose is used, oral route, in compressed 2 to 10 milligrams every 5 hours. Although its effects are less by this route due to having to be absorbed by the intestinal organs, being partially degraded by the liver. The oral route is chosen when you want to avoid the side effects of high doses. by intramuscular. Usually cycles are used and not continuously, only in training periods for muscle mass definition. Resistance gain. Increase specific strength and strength in climbs. To greatly increase your resistance in climbs, use the daily dose of 100 mg. Intramuscular, and this dose can be split into 2 injections of 50 mg. It can be associated with other anabolic steroids but with more risky effects. And it should be used in short cycles of use only at the beginning of the most stretched phase of training. Never above 3 months with 6-month intervals without use for the protection of the liver. Final considerations. Always seek the guidance of a health specialist before starting the consumption of this anabolic drug to avoid severe complications to the body. The sale of this anabolic drug in the injectable form has even been banned in Brazil for being considered doping. Always remember that for you to get stronger and more resistant to cycling, you must subscribe to the channel and comment on our posts. And if you want to know everything about substances,